All right. Well, let's get started with Chapter 6, Medical Terminology Review, and what we hope to accomplish in this particular talk today. Okay, we're going to try this again. Had a little glitch with my PowerPoint. I'm not sure why the slides didn't advance, but we're going to cover medical terminology review, and they don't seem to want to advance. There we go. What we hope to accomplish in this particular talk is to explain why using correct medical terminology in a medical setting is important. We hope to identify and describe three word parts that make up a medical term: prefix, suffix, and root. State why understanding how each word part functions is important. And we're going to pronounce various medical terms correctly by applying the appropriate pronunciation guidelines. We're going to correctly change various medical terms from singular form to plural form. We're going to define and give example of a homonym, an antonym, and a synonym. And we're going to describe the impact on patient care when paramedics have a solid grasp on correct medical terminology. Now, medical terminology is the language used in medicine and in healthcare. And as a healthcare professional, it's important that we learn to use correct medical terminology. Medical terminology records every aspect of the patient care. And in order for us to understand medical terminology, it's important that we know its origins, we know what makes up these words, and some guidelines, particularly when going from singular to plural. That allows us to use these terms correctly. The use of incorrect medical terminology certainly is ineffective because the person who is either reading your material or listening to your report doesn't have a clear understanding or may get misinformation, which may lead to harmful treatment. And one other thing to consider certainly is a loss of trust in the paramedic if they can't use the words appropriately, and can also lead to a lawsuit. Now, the majority of medical terms come from the Greeks and Latin words. Usually the Greek words refer to disease, where the Latin words refer to anatomic structures. And medical language is both a combination then of Greek and Latin words. Now, a medical eponym are words named for a specific person, place, or thing. And in medicine, mostly people who discover it get the name. As an example, Alois Alzheimer's. Of course, the disease Alzheimer's was named after him. Addison's disease, Cullen's signs, Beck's triad. So these would be eponyms. And the eponym can also be a specific thing, like athlete's foot or tennis elbow. Those would be good examples of eponyms. If we look at a large medical word and we're not sure what it means, sometimes it helps if we can break the word into smaller parts. And typically words have three parts. You've got a prefix, the root word, and then a suffix. Now, root words establish the basic meaning of the word. We have compound roots, words with more than one root, where each word root keeps its basic meaning. As an example, frost and bite, that's two root words, but when placed together, each word keeps its basic meaning. Frost being cold and bite meaning a bite. And you look at bedpan, again, two words, bed and pan, and they each keep their own meaning when combined. Prefixes introduce another thought or explains the word root. It's added before the word root. It does not change the meaning of the root word, but it may change the meaning of the medical term. Oftentimes prefix describe what, how, why, and when of the root word. A good example would be the root word pnea, P-N-E-A, means breath. If you add the prefix a, the word becomes apnea, and a means without. So apnea now becomes without breath. Suffixes are added at the end of the word, and it changes or adds to the word's meaning, and it provides further definition of the root word. We're able to change medical terms to nouns or adjectives as needed based on the suffixes. If you take, for example, the root word neur, N-E-U-R, it means nerve. If you add the suffix neuralgia, A-L-G-I-A, algia, which means pain, the new word neuralgia means nerve pain. Combining words and vowels, some word roots cannot combine with other word roots. A word root with an added vowel can't combine with another word root with a vowel. Guidelines for use concerning this: use before a suffix that begins with a consonant used to join other root words. Do not use before the suffix beginning with a vowel. As an example, cardi, referring to heart. O is the vowel that you add in there, and ology is the study. So cardiology, you're adding the O after the I. Cardiology is the study of the heart. Pronunciation, when we look at vowels, if followed by another vowel, the first vowel receives the long pronunciation, and a macron is placed over the vowel. If followed by a consonant, it receives the short pronunciation. Spelling. Spell check is not always reliable. If you look at the word there, certainly if you spell it T-H-E-I-R, and you mean it to mean the car was found over there, spell check is going to say the word is spelled correctly, but it's not the right word. And spelling is especially critical because misspelled words can use to confusion of the reader and possibly even lead to misdiagnosis. When we talk about pronunciation of medical terms, consonants, some are soft sounding and some are hard sounding. And then we have some that have unusual pronunciations. Two consonants together, or X as the first letter, is an example of unusual pronunciation. Like the CH in chromosome is pronounced as K, which is a hard sounding. The PH in pharynx is pronounced as an F, which is a soft sounding. When we have to make medical words plural, it's formed by adding S to the singular form. Hands, as an example. One hand is a hand, and two hands would be adding the S to the word hands. Now, nouns ending in S, CH, SH, instead of adding just an S, we have to add an ES. Sinuses, for example. Because the word sinus ends in S, to make that plural, we have to add an ES. Nouns ending in Y, preceded by a consonant, we change the Y to I and add ES. Capillary, as an example. Capillary ends in a Y. To make it plural, we have to drop the Y, add an I, and then an ES. Nouns ending in O, we add an S or an ES. Embryos, for an example. To make embryo plural, we can add an S. Nouns ending in F or FE, we drop the F or FE and add a VES. Calf is the singular, and to make calf plural, we drop the F and add a VES to make calves. Isn't the English language wonderful? Forming plural words from Latin and Greek nouns, nouns ending in an A, we add an E. So as an example, petechiae, which ends in an A, becomes, to make it plural, we add an E to that. It's now, petechia is the singular, petechiae is the plural. Nouns ending in AX or IX, we change the X to a C and add ES. So as an example, appendix, if we're talking about a single appendix in a book, if we want to make that plural because there are more than one appendix, as an example in your state protocols, we have Appendix A, Appendix B, Appendix C, and if we want to include all of those in its plural form, they become appendices. Nouns ending in EN, we drop the EN and add an INA. So as an example, lumen, which refers to the inside diameter of a vessel, becomes lumina. Nouns ending in EX, we change to ICES. So cortex becomes cortices. Nouns ending in IS, we change the ES to IDES, IDES. So psychosis, the singular, becomes psychoses. Nouns ending in MA, we change to mata. So sarcoma, which is the singular, becomes sarcomata. Nouns ending in NX, ANX, INX, or YNX, we change to NGES. So phalanx, which refers to a finger, becomes phalanges when we're talking about more than one. Nouns ending in ON, we change to A. So phenomenon becomes phenomena. Nouns ending in UM, we change to an A. We drop the UM and add an A. So ovum, referring to one ovary, becomes ova. Nouns ending in Y, preceded by a constant, we change the Y to I and add ES. So artery, we drop the Y and we add an I and an ES, becomes arteries. Forming plural words from Latin to Greek require us to understand those principles, because the spelling could be incorrect, and again, incorrect spelling can lead to confusion and misdiagnosis. Homonyms are medical terms that sound alike, but they're spelled differently with different meanings. Antonyms are root words, suffixes, prefixes that have the opposite meaning of another word. The antonym of sad is happy. The prefix added towards the prefix add means towards. Adduction. The antonym would be the prefix ab, which means away, or abduction. Synonyms can be root words, prefixes, suffixes, same or similar meaning. Pulmon and pneumo both mean lung, but there's no such thing as a pneumonologist. Pulmonologist would be the correct term. When it comes to abbreviations, some abbreviations are standard and they are used universally, but you need to check with your local EMS provider, your hospital, for an approved list, because the exam certainly some abbreviations mean different things to different people. If you look at LOC, LOC can mean level of consciousness or loss of consciousness. And so it's important that if you do use abbreviations, you use them from an approved list. If you choose not to use abbreviations, or if you don't have the approved list of abbreviations, it's important that you write the word out fully. To understand medical terminology requires practice. Practice breaking down the large word into separate parts and looking these words up, certainly in the glossary or a dictionary when studying, if you don't understand what the word means, will help you. And of course, the more you use the words, the more familiar you become with medical terminology. Spelling, pronunciation are all essential elements in effective communication using medical terminology. Errors, as we've mentioned, with misspelling, mispronunciation, can endanger the patient's health and your reputation. And proficient use of medical terminology not only demonstrates professionalism to the patients and the families and healthcare providers, but it establishes credibility with you as a provider. In summary, paramedics who use medical terminology daily must know how to determine the meaning of the term. Word parts are used to build medical words, and they include root words, prefixes, and suffixes. And understanding the function of the word parts helps determine the meaning of unfamiliar medical terms. Practice makes perfect, so using flashcards, practice writing, saying the word, looking it up in a dictionary certainly will all help you understand medical terminology. Practice pronouncing difficult medical terms. No guidelines for changing English, Greek, and Latin words from singular to plural. And I know I listed a bunch of those guidelines, and the expectation is that you not memorize those, but maybe even know where that information is when you're changing a singular word to a plural word. A homonym is a word with the same pronunciation as another word but with different spelling. An antonym is a word of opposite meaning. A synonym is a root word, suffix, or prefix with the same or almost same meaning as another. And the correct use of medical terminology creates a good impression and builds credibility with the patients and the family. Thanks again. If you have any questions, feel free to contact me, again, either at this web address or on the bulletin board at the Iowa Western Community College webpage. Thanks, and talk to you soon.